Head-to-toe skin assessment. This should be done upon admission and at a greater frequency depending on the risk factors the patient has. So where you should be looking most closely is any skin over a bony prominence. So everyone always thinks of the sacrum and heels, but also make sure you're checking the hips, the torso, the thighs. You can get really, really bad wounds on the thigh. You can get a pressure ulcer there. So you want to also look under any medical devices if they have oxygen tubing. Particularly pay attention to the area where the tubing lies over the ears. I have seen injuries occur over that. As well, very important, people who have immobilizers, usually on their leg, those can be very dangerous. They can really cause a pressure injury. So every day, really, that immobilizer should be taken off. The skin needs to be looked at. Apply padding under the immobilizer if needed, such as an ABD pad or a protective dressing. That's very important. Also, if you notice erythema, which is a red area and it's over a bony prominence, what you want to do is press on the area to see if the area blanches or not. If you see my finger here, it's kind of red, right? You press on it, it turns white, and then goes back to the pink. That is what should happen if you press on a reddened area over a bony prominence. If you do find that there is a red area that is non-blanchable, you can apply a transparent protective dressing. That way you can monitor how it looks easily. Other signs that a pressure injury may be forming are localized temperature increase of the area, swelling, any changes in the way the skin looks compared to the other skin. Now, stage 1, however, may look differently on persons of color than they do. So if you notice any of these, you really need to put more emphasis on reducing pressure in daily care of that patient. Stage 1 pressure injuries, those are a red area that does not blanch like I did with my finger. This can look differently in patients with darkly pigmented skin. So looking at feeling the temperature and moisture to the area are really essential for persons with a darker pigmented skin. Now, when should you do this skin assessment? In long-term care facilities, you usually are going to have to do it upon admission and then weekly thereafter. However, if a patient begins to decline, perhaps they stop moving as much, or they had a fall and it hurts to walk, or there's some reason that they're deteriorating, you need to check their skin more often because they're all of a sudden at a higher risk of developing a pressure injury. Pain should always be assessed during these skin assessments because that is another way that you can tell if a pressure injury may be forming, because oftentimes it will be painful before it opens up. So this is how inspecting all of the skin can help prevent a pressure injury. Let me know if this helps, and have a great day.